meeting tonight. I know it was a choice of, we have city council and we have other activities, so the fact that you chose to. This is part of the Building Merrill Together program series. We did have, I call it part one, was October 3rd. It was mental health among us at work, in school, in our community. And Kristen did present facts on Lincoln County. And then we had a gentleman, two from the veterans, one middle school counselor. We had a private counselor. There was 2 other people on the panel.
North Central Healthcare.
Yep, North Central Healthcare. And
Sue Norrenberg from St. Vincent.
St. Vincent said yes. So it was very good, but now we're gonna take it one more step, and this is part of adult program. I don't work for the library, but they do contract for me to help publicize these issues and the Wordsworth hearing and the Building Merrill Together series. It's part of the adult programming here at T.B. Scott Library. And it's a safe place to discuss sensitive issues, and we've had no problems with people respecting each other's thoughts and feelings, and but we've had passionate discussions here. We've had differing opinions, but the difference here at the library, unlike the world out there or politics in general, you know, we don't go into name calling or belittling, or so be respectful. And John Greenwood from WIPS has moderated many a program, and he first introduced me to deliberations. That was a new concept, so I appreciate that. And John, we appreciate you being here.
Thank you. Well, we also appreciate everybody coming out tonight to participate in this deliberation on mental illness, which certainly is a significant issue here in our community, but also, of course, in our nation and the world. And tonight, I got involved with deliberation about 8 years ago with the Wisconsin Institute for Public Policy and Service, and I didn't really know what it was, but the more that I got into it, I became kind of fascinated with it. It's a decision-making process, a little bit unlike a debate, which has 2 different approaches, and somebody wins and somebody loses, sometimes, or most of the time, versus a deliberation which has 3 different options. And actually, it's a pretty structured dialogue, because what we're going to do is go through what the Kettering Foundation, who developed this, calls an issue guide. And everybody has one, and we'll go through it pretty specifically and try to look at the benefits and the drawbacks and the trade-offs of each of the 3 options. Now, there are 3 options here, but obviously this is an extremely complex issue. So there are other options, obviously. And the idea is for us to try to, in the next hour and a half or so, come to some common ground as far as what we think might be effective in helping us move in a positive direction with this very complex issue. So, although this crowd, I know most of you are very civil, but we do have some guidelines up there, and I find as a facilitator that it's really important to have them. I'm sure I know there are facilitators in our group here who probably feel the same way. But we just want to respect each other's thoughts and feelings. We encourage you all to participate, with not 1 or 2 people dominating. I like this one: when you disagree with someone, listen harder. I try to do that, but sometimes my emotions get the best of me. But we're seeking understanding here as a group, as opposed to, like I said, with a debate. It's more like persuasion, but here it's more seeking understanding. Turning off cell phones is kind of a no-brainer. But are there any other guidelines that you might like to have for our group?
What about confidentiality, since the topic
Confidentiality?
fragile, sensitive? Yeah.
That's a good idea. In other words, what's said in the room stays in the room. Is
So
that?
just a hope for that.
But I would say just if it's details that are, I can see the discussion going further. In fact, I have someone, a different panel that wants to already talk about addictions and quit talking about symptoms of mental illness, let's talk about causes. And so I know I'm going to share some, but I will be careful of any details that might need to be confidential. But the overall flavor of where we discuss, I think we could go there, just not if something details come up that may or may not.
Anybody else have a thought on that? I know that usually my thought would be that whatever is said in here stays in here. We don't go all over the city and talk about that and stuff. Is that okay with people?
It may be a little difficult since it's being recorded.
Now, that's an excellent point.
Yeah.
As I'm looking at the camera.
If you feel it's confidential, you just don't.
Okay.
You just don't talk about it.
Yeah.
I'm sorry, can you make that comment again?
How about we refrain from disclosing confidential information to each other? If it's
Especially-
confidential, we won't share it in the public forum, strip the names out.
There you go.
Especially because it's being recorded.
Yeah.
No
Yeah.
unmasking, there you go.
Thank you, Debbie. Okay. So, what I'd like to do, we all have this issue guide, and I'd like to read out loud the first, the introductory paragraph, and also the introductory paragraph to each option. And you can see, if you open the pages there are 3 options. And as I'm reading these, I would like you to think about a personal story or an example, perhaps from yourself, from your family, from perhaps friends or a friend that you know, or maybe you just observed it, not just, but you observed it in your professional duties and so forth. And then I'm just going to ask a few people to share that if they would be willing to. So here we go. Mental illness in America, how do we address a growing problem? Many Americans share a sense that something is wrong with how we address mental health and mental illness. More and more of us are taking medications for depression, hyperactivity, and other disorders. Meanwhile, however, dangerous mental illnesses are going undetected and untreated. According to some, recent violent incidents reflect the need to increase security and increase our ability to detect mental illness. Others point to increasing numbers of veterans returning from overseas with post-traumatic stress disorders as a major concern. 1 in 5 Americans will have mental health problems in any given year. Unaddressed mental illness hurts individuals and their families and results in less productivity. In rare cases, it can result in violence. So option 1 is put safety first. Individuals with undiagnosed or untreated mental health problems create difficulties for themselves and those around them. While the vast majority of mentally ill people are nonviolent, and in fact more likely to be victims of violence, some are not. This opinion holds that more preventive action is necessary to deal with mentally ill individuals who are potentially dangerous to themselves or others. We should identify those who need help and intervene where necessary to prevent them from harming themselves and others. These individuals should be sought out and their needs addressed. However, this would interfere with people's freedom, and some people could be forced into unnecessary treatment. So let's go to the second option, which is to ensure mental health services are available to all who need them. Studies show that people who have mental illness can very often recover with a combination of therapy, medical help, and continued support. Yet access to mental health services varies widely from place to place. Too many people are unable to get the help they need. In some cases, they are discouraged from seeking help due to social stigma. In other cases, they cannot get a needed doctor's referral or their insurance does not cover services. This option holds that people should be encouraged to take control over their own mental health and be provided the tools to do so. We should make sure that everyone who wishes can get the help that they need. But even when mental health services are available to all, many will not seek the help they need. And then finally, option 3 is let people plot their own course. As a society, we have become oversensitive to behavior that previously would have simply been considered different. In the majority of situations, a person's state of mental health doesn't affect others. Yet, professionals keep expanding definitions of mental illness to encompass more and more. But not everything has to be treated and medicated. Even when problems exist, people should make their own decisions about whether to seek treatment. This option holds that we should not rely on so many medical approaches. We should reduce our dependence on drugs and allow people the freedom to plot their own course to healthy lives. In many cases, simple changes in lifestyle can improve mental health. But such a hands-off approach may ignore people who are potentially dangerous and need intervention. So as I was reading those 3 options, what I'd like to ask any one of you, if you'd be willing to volunteer, to tell a little example or story of how these different issues that have been discussed in these options might have influenced you or made an impact on your life.
We didn't want to dominate 1 or 2 people, so we're being careful.
What are you looking for examples? I'm sorry, of what?
I'm just looking for a life example. I'll give one from my own life. With regard to, I have a situation, a family situation. Good evening. Sign in. I have a family situation with my elder sister who lives in Green Bay, and she has a grandson that she has had living with her for many years. Unfortunately, the grandson is somewhat emotionally abusive to her and also exploits her financially. So this has been a significant stressor on the family. And so as I look at that, I see there are some unhealthy dynamics going on between the grandson and my sister. And I think there's some mental illness issues that are occurring that are definitely have a tremendous impact on her, and certainly on her daughter, who lives in New York, and myself, who was attempted to be the POA, but that's been very difficult. There's an example, and just wondering if anybody else would be willing to share.
I have one from a long time ago when I was young and crazy, but a young man that was a starting professor at UW-Whitewater, and I was a student there, followed me up to Wisconsin when I left, or up to Wausau when I left, where my parents lived, and I was in college, so I was in and out of my parents' house. But I thought he was fascinating because he stalked around the campus wearing the black robes like an Oxford Don and the mortarboard and all that. And he was an English professor. His name was Lindsay, and all of a sudden, 2 days after I left Whitewater, there he was at the door of the duplex that my parents were temporarily living in, and they're like, "Who's this Gene?" So I said, "I really don't know him very well," and it turns out he followed me all the way up there. And he sat down to dinner because my mother was gracious enough to say, "Well, he came all this way." And he began to tell my family that he was Ross, King of Ireland, and I was destined to be his queen. And so he'd come to claim me, and right away, of course, their eyes started bugging out of their head, and none of us had had any experience before with paranoid schizophrenia, which she clearly was. And that night, we took him to a little hotel, like bad motels on Schofield Avenue. And I sat with him for a while and left him with a book of my poetry that he effaced. He wrote out all my poems and crossed them over with babbling things about, they were quasi-biblical statements and, I don't know, admonishments about the fate of Ireland. And then he wanted my cross that I wore around my neck, and he pulled out a gemstone that night from the cross and replaced it with my true gem as the Queen of Ireland. And then he burned his palms with cigarettes to be stigmata, and came to our door for breakfast the next morning to present my altered poetry, my rearranged silver cross, and then his stigmata. At which point we did track down his mother down in Whitewater, and she came up and collected him and hospitalized him. So he might fit under your option 2, but I don't know which of these options it would be.
Well, obviously, he had some issues with his military.
They were very apparent, but we didn't know because we didn't have any experience with, and the kind of people I brought home during my college years. More.
And then she married me wholly.
Yeah. I couldn't afford a shrink, so I married one.
It didn't work, but anyway. So if you feel you want to share, you can, but I understand the,
Well, where do we go with dementia in this?
Oh, yeah.
Because people that are, and I'm just gonna use the word sane or level-headed their entire life, and they hit dementia. And Alzheimer's has made the most headlines, but there's people that have suffered TIAs or some small strokes, and so I find that's an area that is a gray area. When does it cross, and when is forgetfulness mental illness? So,
yeah, it's a definite issue with so many families, and we experienced that as well in our family. So what I'd like to do is, I'd like to now go back to option 1. I'm just going to reread the first paragraph of option 1, the introductory paragraph. But then I'm going to give you a minute or two, a couple minutes, to look over and just silently read the examples of what might be done with this particular option. And then right across from it, you'll see in the next column some trade-offs to consider. In other words, every time we make a decision, we have to give up something. And what this guide is attempting to do is to just give us some of those examples as well. So this first one, putting safety first. Individuals with underdiagnosed or untreated mental health problems create difficulties for themselves and those around them. While the vast majority of mentally ill people are nonviolent and in fact more likely to be victims of violence, some are not. This option holds that more preventive action is necessary to deal with mentally ill individuals who are potentially dangerous to themselves or others. We should identify those who need help and intervene where necessary to prevent them from harming themselves and others. These individuals should be sought out and their needs addressed, but this would interfere with people's freedom, and some people could be forced into unnecessary treatment. So just take a few minutes and read silently to yourself the examples of what might be done and then some consequences to consider.
And what I'm going to do, and this is what separates us from just coffee shop talk, is just as it's being recorded and she will take notes. I'm gonna try to put benefits, drawbacks, and trade-offs with each one of these options. You know, so you know your thoughts are being recorded, they'll be just like bullet points, but, and one, Jean and I talked about the one that, just because it just happened, would be the Las Vegas millionaire.
Right,
Yeah.
what's that mental illness? We'll never know.
We'll never know. I think that's what's frustrating to the authorities at this time. But that's one that people will beg to say, safety has to come first. And, while it's not a local, I'm just, if that's okay, let's start, I'm just gonna write, not just that one, but there's been other, I don't wanna call them shooter, but let's call them violent episodes, if that's okay with you guys. Because I think right now, that's where the society is grappling with, is violent episodes are begging for safety first. Benefits will be for safer, but.
Okay, thank you, Chris. So I have a question for you. In terms of this option, which obviously is trying to add more structure and focused on safety in society, what do you like about the approach? Are there any benefits that jump out at you that you really think are good about it? Yeah.
I have a friend whose son is schizophrenic, and she knew he was having major problems, and then he unfortunately killed his girlfriend. And then, you know, of course, he is now, in prison. So if that girl would probably be alive if, you know, they would have, you know, if the mother was able to institutionalize him and keep him there. So that would be an example of, you know, a benefit of, you know, the violence wouldn't have occurred then.
Is it because you think it was partially because she didn't understand some of the violent signs, or?
She understood it, but she couldn't get the doctors to understand it. She's seen the change in her son, but she couldn't get them to, they just wanted to change his meds and kept telling us it was okay. And she kept saying, no, it's something, and, you know, she couldn't pinpoint to say this was what he's gonna do, but she knew it wasn't good, so.
And that's a real difficulty. It's a gray area in our culture, because the police would probably say, well, he hasn't done anything yet.
Right, that was, so.
That's an excellent example.
It's a high bar to take away someone's autonomy.
Right.
Yeah.
So there's a tension between the safety of the young lady, but then also the autonomy of the individual, particularly in the United States, where we value so much individual freedom. That's a
I
real-
think this brings up more questions than answers, because you need to, who's gonna decide that, what test are they gonna perform? You know, what's the criteria? I mean, I don't even know how you would even ever implement this, because there's too many questions to.
And can't you recover from some mental illnesses where you can be autonomous again?
We have well-defined criteria for mental illness syndromes. That is to say, we cluster together a group of symptoms and say, this is X, Y, and Z mental illness. So whether it's major depression or bipolar disorder with its manic and depressive episodes, or schizophrenia, and so forth. And since we've been doing this, the medical community has created these well-structured diagnoses. We can look at the natural history of some of these diseases. We can follow them over time and say that some are more likely to come back to relapse and then remit. Others are more likely to appear for a period of time and then go away. What we haven't been able to do is to predict well in a specific individual which course they're going to take. And there are some warning signs that we might be able to point to that an individual is maybe going to have a problem, but we can't always predict that with a high degree of accuracy. And many of our screening tests are very sensitive. That is to say that they're more likely to be positive if someone has a problem than not. But they're also going to pick up a lot of people that don't have problems in that same group, because there's a lot of false positives as well. They tend to have a low specificity, so very few false negatives. This is to say that if the test is negative, you probably don't have that problem. But if it's positive, you may have it or you may not. And that will pose some challenges with an option like this. That being said, in scenarios like you described, so schizophrenia as an example, broadly speaking, individuals who are schizophrenic don't like how the medications make them feel, and will, when they take their medicines, get to a point where they feel better and then voluntarily just stop their medications. And often that creates a cycle where they take their medicines, get better, decide they don't like how they feel on them, stop them, and then get much worse. In some cases to the point where they end up institutionalized and get back on their medications, get better, and the cycle repeats itself.
So 2 points, Steve, that I'm hearing. One drawback is that it's extremely difficult to predict how, let's say, violent a person might be. First, that's a drawback, because can it really be done, as Renee is questioning. The second is that with more severe mental illness, you've got this medication dance that they're doing, and that's an unpredictable factor as well, because the person may be doing quite well, and as you say, then they're not feeling that good with the medication, so they quit it. So I guess the inconsistency of medication, would that be a factor that?
Call it the inconsistent use of medication, in part because of side effects. We are not at a point in brain science where we can tailor our medications to avoid many of the unpleasant side effects that these medications produce. People often describe themselves as feeling flat or emotionless or not their best creative selves when they're taking these medications because of, frankly, how the medications are working and the effects they're having.
Okay. All right. And other thoughts or ideas about this approach? Remember that we're trying to get tougher on monitoring mental illness with this approach. Any thoughts about some benefits of that, even though it's difficult to do? Yes, Eric.
I think a benefit is people be aware of their mental health situation with the more consistent mental health tests and checks.
Okay, so people themselves would know more about themselves as far as if they're having some symptoms, if they're having some difficulties, that would be better defined for them. So that would be a benefit,
Yeah.
to have more of that sort of diagnosis going on. Anyone else? Yes.
By becoming a regular part of or a routine, it becomes more like going for an annual physical. And it may actually take some of the stigma away from being diagnosed with a mental health.
So the more routine it becomes, and I notice that when I go to the doctor, there are questions about, am I depressed, more affective, am I being abused, that sort of thing, which probably helps considerably in terms of identification, and that's hard to do otherwise.
There are strong recommendations to screen for depression, particularly in individuals with chronic health problems, as well as just a general or blanket screening of everyone that presents to a healthcare center.
So Debbie, your point was the benefit of this would be that the stigma would be hopefully lessened because we have more acceptance in our culture of, hey,
And it's routine.
it's part of what we need to look at. Any other, haven't heard too much from this side of the room, any other positives, or are there any drawbacks? Mark?
I can't really quote the statistic accurately, but they, the whole correlation between safety and mental illness, and with firearm incidents, they were just saying, if the mental illness is projected at 20% of the population, and the number of people with mentally ill who are responsible are much less than that, a fraction of it. And they're much more likely to harm themselves in many instances than to harm other people. And so I hate the direct correlation with mental illness and violence. exists, it's there, but it may not be as easy or as we try to, as the press makes it.
For example, well, this first one here on examples of what might be done, require mental health tests for anyone seeking sensitive jobs, such as teaching and police work. And Debbie, what I hear you saying is that might not be a bad idea.
No, I'm just saying that by making it equivalent to going for an annual physical, that it becomes just, again, the norm. It's not so stigmatized.
Okay, I
Wouldn't the drawback be the expense of it though?
The expense of,
I don't do annual physicals. I don't do none of it. Flu shots, mammograms, colonoscopies, I avoid all of that stuff. So why would I possibly go for, and I'm probably off the Richter scale, so why would I go to a routine screening?
so
'Cause
there's a financial issue, so that could be a drawback for people that, hey, I don't wanna spend the money, I don't believe in doctors, or I don't have the money, that sort of thing.
Although if it's more required, that should drive the cost of it down.
Ah, theoretically. I call it the medical industry, not
Yeah,
The
healthcare
point is,
anymore.
people are seeking a robust, care is being developed. If everyone now has to take an exam for mental health, that should push the financial costs down. That should be a market driver, at least in
So
that
that-
direction initially.
That could be a benefit then, that hopefully with,
Mental care would be more covered and more affordable and accessible.
and diagnosed earlier,
Right.
and hopefully.
And also the reducing the stigma, that would all go hand in hand.
Unfortunately, within the healthcare system, there would be an initial rise in cost because there aren't enough providers. Whether it's physicians, be them psychiatrists or general practitioners or the like that are helping carry that out. Also, though, needing counselors, so licensed social workers or licensed professional counselors, and building an entire mental health care industry within the larger healthcare system, because we haven't made those investments at this point, so there'll be a larger upfront cost, though long-term it should
It
drive
would
the
just
price down.
change the loss leaders. It would shift.
And when you see figures released by labor statistics and such of cost to society of lost work days, are those thrown in with addiction-related lost work days? And if so, that begs the question, is addiction considered mental illness? Where is the fine line between those things? You can use perhaps depression as a middle ground or a meeting point, but they are, in some regards, three separate things considered that way: addiction, mental illness, depression. But they all bleed together on a continuum too, and they're all a big cost to society. So Robert and Miranda, if culture looked at them that way and saw that it's really cost effective to be preventative by screening for all three, the cycle could perhaps be economic benefit.
Yeah.
So there could be some.
And it may become more clearly delineated too.
That
The more
would
you
help.
focus on that, if there's a need, the market will meet it. Amazon wants to sell prescriptions.
Yeah.
So-
Yeah.
Are there any drawbacks that you see that just kind of jump out at you as far as this option? Here, off the top.
Misdiagnosis. False misdiagnosis,
Okay.
false accusations. You ruin somebody's life.
Yeah, there's one action step in here of people reporting other friends and coworkers that they think, well, have some mental illness issues, and that could get to be a little dicey.
That's kind of related, that there's high consequences if you're diagnosed as mentally ill in some way, then you have to lose your job for a few weeks or months. You know, it's a big consequence for people.
And the stigma of it?
I think it would kind of stigmatize it more.
It possibly could.
You'd be trying to avoid being diagnosed.
So I have to ask this question because of Las Vegas. Here's what I was thinking, should we require background checks and or mental health tests for anyone seeking to purchase guns or certain types of guns? Should we require background checks and or mental health tests for anyone seeking to purchase guns or certain types of guns?
I'm a believer in the background checks, I do. I don't know how you'll get people to take, check into their mental health, I think that's sort of overstepping the bounds, which is, whichever way, but background checks.
Also, what type of test?
Yeah.
And which mental illness are we
Yes.
going to
Oh,
restrict?
absolutely.
I would prefer not to have the schizophrenic with paranoid delusions purchasing guns. By the same token, that same individual on their medications who is perfectly sane and wants to go out hunting with their friends, at what point do we find that balance? And an added problem will be who conducts those tests.
And there'd be a snapshot at that point in time,
Right.
that would indicate the larger issue.
There was, I forget if this was when I was in medical school or residency, an idea bandied about in Illinois about requiring some form of mental health test before people could get their FOID cards, the firearm owners ID cards that are required in Illinois. And if that had gone through, there weren't enough psychiatrists in the entire country to meet the needs for the state of Illinois. It's the kind of thing that would have been impossible to implement. This is an idea that sounds good until you start looking at some of the details.
Yes.
The idea popped in my head, I'm probably squirreling off here a little bit, but when we talk about put safety first, one of the things that popped into my head is when the abusive husband and they separate, and that's, to me, that's what you hear quite often. How does that fit in? Would we deem him with mental illness or just being upset? But she's at rest many times, and that's, I guess when you were talking about this, that's what popped in my head, and I guess I'm just sort of putting it out there when we talk about safety first. Should we be checking, is that the person we need to check for mental illness, is the ex-husband or the abusive husband? You know what I'm saying, sort of a long drawn thing here.
Stressors on mask things too.
Pardon?
So wouldn't stressors also on mask things too, and nobody was really stressed free?
Right. I just,
It's complex, it depends on the situation. Her situation is different.
I guess I'd just like to add, just numerous studies have said the best predictor of future violence is past violence. And if you could focus in on violence, sometimes that will take in a mental health population that would be violent, which is a minority, as well as other people who haven't been diagnosed as mentally ill, but who have been criminally violent. If you want to stop gun violence in the future, you look at their past in terms of violent behavior.
And then, would there be some sort of commission though, or how would that be implemented then? Somebody would have to make a kind of a clinical decision, right, on each individual.
Well, or you have categories, if you've committed certain types of felonies or certain kinds of violent acts that would prohibit people being able to possess firearms.
Well, and one that's in there is often if someone has abused animals, they are more likely to be abusive or violent to people. That has shown to be
We're assuming they're gonna buy a gun at a dealer. Okay, let's go to a gun shop.
For the background.
So,
So I just want to ask this, and it's my own curiosity. with the Las Vegas shooting, there was I think it was a bump stock that was used. Do you think that should be a legal accessory to put on a gun or not? Do you have any opinions about that? And that caused the gun to be able to shoot rapidly.
I think it should not be because machine guns are not legal. And so it made something that was a legal gun into an illegal.
I agree on that.
All right, well, thank you. Let's go to option 2. There, again, I'm going to read just to refresh our memories, the first paragraph, and then take a few minutes and please look at the examples of what might be done and some consequences or trade-offs to consider. Studies show that people who have mental illness can very often recover with a combination of therapy, medical help, and continued support. Yet access to mental health services varies widely from place to place. Too many people are unable to get the help they need. In some cases, they are discouraged from seeking help due to social stigma. In other cases, they cannot get a needed doctor's referral or their insurance doesn't cover the services. This option holds that people should be encouraged to take control over their own mental health and be provided the tools to do so. We should make sure that everyone who wishes can get the help they need. But even when mental health services are available to all, many will not seek the help they need. Okay, so just want to ask the question again, what do you like about this approach? What appeals to you about it? What are some of the advantages of providing services for Yes, Eric.
I think universal access to healthcare of any kind is something that it would just become part of culture, that if you feel in a certain way, you can go and get access to care of some sort. And I guess maybe an extreme example is, we've seen a documentary, I think it was Germany, that they could have a prescription to go to the spa for like 3 weeks, so they can get out of work for that time and have their get massages each day and have a mental health retreat type deal.
Is that offered through, through the government or some
Yeah.
sort of government program? So they were valuing having some sort of intervention.
Yes.
I'm just saying, just how much healthier we would be if we would do those things, or could do those things.
Have an opportunity to. So are you saying that if we were to have a government program like that, that would be helpful? Is that what you're thinking?
Yeah.
And I just beg to differ. Who's gonna pay for that? Well, you're gone from your job for 3 weeks. the employer has to figure out a way to fill it.
So,
But then,
so a drawback is
Yeah.
that it does cost, there's a
Mhm.
financial cost, so that's a drawback to it. I mean, somebody's gotta pay for it, right?
But in the long run, you have a healthier employee that comes back and more productive when they hire.
Okay, so a benefit would be healthier employees who do more productivity on their job. That's a benefit.
And that model really treats the whole individual, not just physical, it treats the whole body, the whole person.
When you say the model, Debbie, you're referring to like the health spa thing?
Well, it recognizes that health is beyond physical, that there's another component to health that I don't think as a country we have recognized. That mental health is an important part of health.
Just.
Okay, so the German program is actually highlighting that.
Yeah, the mind-body connection.
Would
Our
that-
American culture has changed so in the last 40 years. And we should follow some of the European ideas.
How?
I just heard about, this weekend on, Copenhagen. I think it's, I'll have the TV news thing on more like a radio, but I think they said that they, in this calendar year now, they are like totally 100% green. They're not making any carbon imprint. And I mentioned that to someone that I saw at a wedding yesterday, and she had been to Copenhagen, and she said it's the only city that you, when you come in to the airport, there is like no haze. There is, you do not see a haze as you approach that country. And I did not realize that. But, you know, I mentioned to her what I had heard about it. And the people are, this reporter that was telling about his visit there, he said the people seem like so happy, and it seems like I read something in the last 5 years too that, like, I don't know who does these studies, but Denmark had like some of the happiest people in, among the countries that were interviewed.
So you're looking at also from somewhat of a societal perspective, that they're not only looking at their mental health and their physical health, but they're looking at the health of the environment
Yeah.
as well.
And they said that their birth rate, see, and this I knew like 20 years ago when one of our daughters was in Norway. She was there for a whole year and never interacted with a single family that had a child under the age of 2. That, those people were not having larger families, but this reporter said that the birth rate in Copenhagen and Denmark has increased because this younger generation now that is feeling so-called more content and happy and feeling like they can see a future, they're deciding to have children and have a family. And I thought that was a cool thing to find out.
Kind of a benefit, again, of appreciating what mental health means and physical health.
Most of the people are using bicycles, you know, to get to work. They eat very healthy. And this, this person yesterday was saying, yeah, they, like, most people don't have freezers. They just shop, everything is like fresh. You eat what's in season. Go to the market. We have so many additives in our
I have a question.
food that's being sold in the grocery store.
So I have a question, and I think it's related to what you're saying about other countries. Do you think in America we value mental health as much as we could or should? Renee, you're saying no. Why? How do we not value it?
But just, as I was being raised, if you had any problems, you went to work. If you didn't feel good, you went to work. If you were feeling ill, just go to work. So that's how it was, you know, it was, you just get over it and move on. And so it wasn't, you weren't allowed to ever feel sad or feel bad. That just wasn't allowed. That wasn't discussed and it wasn't allowed. Things just said German around here, if you want to call it that.
Culturally, this country is changed, but we've always been we've all worked, okay? We started at an early age and we worked till we retired. And we're also, very independent people. That's what makes us great, right? But until everyone's willing to pay 50% taxes, all of this stuff will never happen. Because I'm sorry, an employer still has to pay for your insurance. So, 3 weeks at a spa, that sounds like a wonderful vacation to me, okay? But someone's gotta pay for it. And universal health care, I believe we need it. I believe it should be a part of what we have, and I'm willing to pay my percentage, but the vast majority of Americans wouldn't, because they don't understand it. They don't understand the amount of money that comes out of their pocket now compared to what they would pay if we had universal health. I mean, we have an associate that is working in California, he's from England, and we asked him, he said, well, how much did you pay for universal health in tax? 21%. Most people pay 30% today and don't even realize it.
So would it be safe to say that an action step for this option would be universal health insurance? Or
But now, here's the other thing that has changed, so in my lifetime, my parents did not even have health insurance. The other thing is, when I was a child, we didn't know anybody that was on so-called welfare. Everybody worked. Now, and some of my sons have said this, they're working for, there's a big percentage, I don't know what it is, in Lincoln County, people that don't work. And somebody I don't know, they're getting money from somewhere.
Well, does that relate to, like, if I'm a poor person and all of a sudden I have a health problem, I go to the ER, I go to the emergency room, and I don't pay, but I get the services, but everybody else is paying?
Well, and there, along that line, in Phoenix, where I have a sister living, one of their beautiful hospitals had to close because they had so many people coming in that didn't have insurance and couldn't pay.
So I'm gonna go back to Todd's point then, Marion, which is, would you say that an action step might be for us to have universal health care in terms of this option, which is saying we need mental health services for all?
I think mental health care, yeah. I think that's what we should have in this country, universal.
Any thoughts on that? Do you have any, major reactions to that, pro or con?
Well, if you're in Canada though, and you're having you probably have a gallbladder trouble that's creating some symptoms. As long as you're walking around, they'll put you on a list, but you're not going to get help with that right away, like you would here in Lincoln and Merrill County.
The difference being
Irish,
though,
yeah.
that's an elective procedure, and
Right.
yes, you're uncomfortable now, and you may be uncomfortable for a period of time, in some cases a couple weeks, a month, but you'll get the procedure, and they have a much better, much more substantial primary care network, which covers 75–80% of all the healthcare needs of individuals at any one point in time. It's the 20–25% of the population that needs specialized care that uses their specialty network. Their balance is about 70% primary care providers, family physicians like myself, compared to about 30% specialty care. Here, we are almost the exact opposite. We have 65–70% specialists, and only about 30% of the physicians out there are primary care. Yes, you can get in and have your gallbladder out tomorrow or next week because it's making you uncomfortable. That in and of itself doesn't make it better care though. It's a procedure that could have waited some period of time. We're impatient, we want things right away here. And that in and of itself is evidenced by use of the emergency departments 24/7 as opposed to call your doctor, no, I don't have an appointment today, but they'll get you in tomorrow morning. To build a universal healthcare system where everyone is covered in some way would require us to uncouple it from employment, so take it out of the hands of employers paying for it, shift some of the premiums employers have been paying away from insurance companies, and for lack of a better way to describe it, stop for-profit insurance companies from paying out dividends and recycle that all into the system. For the mental health piece, it's going to require us to train a lot more mental health professionals. I don't remember the exact numbers, but the estimates are for Wisconsin that we will need a couple hundred more psychiatrists over the next decade, and we are nowhere near training that many. The psychiatry residency that opened in Wausau this year has 3 in their first class. That will expand with 3 more each year up to 12 total. It's a 4-year program. And so in 3 years on from now, we will have 3 new psychiatrists who are trained here in the Northwoods. And maybe some of them will stick around and practice in this area, and maybe they won't.
Hopefully they'll be incentivized to stay.
That's the hope.
That's a tremendous breakthrough. I mean, I know for years, we had Gabby, right? We still have Gabby? How do you do that?
Sort of. She's part of the Child Psychiatry Consult Program, which is a telephone program, so primary care doctors can call in or send an email and get guidance as to how to treat children and young adults with serious mental health issues. And there is some limited availability for in-person interactions, but that's very, very limited.
But even that connection between primary physicians and having that resources is a huge step forward.
Yes, oh yeah, it is a huge.
I have a question with regard to this one, then we'll go on to option 3, but it's one of the action steps would be provide convenient mental health screening centers throughout the community. Do you think that's a viable action step? Do you think that people would actually take advantage of that sort of thing? Well, I'm going to ask Shelley or Kristen, in the health department, from that perspective, do you think that sort of action step would make any difference?
I think it wouldn't hurt, and then if we're going with the scenario where there's, mental health services available, people wouldn't feel like they're just getting screened, and now that there would be follow-up services, treatment for these individuals if there is an issue that's identified. So I see that being beneficial, and if there's different sites throughout the community, transportation access won't be as big of an issue.
So it could be beneficial.
Yeah.
Possibly.
Mm-hmm.
And again, I think that makes it more routine, more accepted. It takes the stigma away from it in some regards. Just like anytime you can make it part of the norm or a community norm, you create less stigma around the issue. The other part of this, I think that's, every time one of these violent episodes occurs, I listen to how the media talks about the person who has done the violent episode. And every time those occur, and media individuals use words like crazy, we take a step backward in addressing mental illness. Because anyone who is thinking about going for treatment is like, not now, I'm not gonna go seek that help. And so, words we say make a huge difference in whether people are going to seek treatment or help.
So that speaks to the whole issue of how the media handles these various tragic events. I know working in the school system that if somebody were to unfortunately kill themselves, the whole idea of handling that in a way that doesn't blow it way out of proportion and possibly create some sort of contagion effect, that sort of thing. Any other comments on option 2? does anybody feel strongly that this is an option that we should really shoot for? Getting these more, kind of trying to lessen the stigma, or the stigma of it, having more access to screenings? Or is that just unrealistic? Who's gonna pay for all that?
I want a hybrid option, 1 and 2 so far.
So you, a hybrid option of option one and option two? So can you explain that a little bit more, how would that look?
Well, there are elements of both that I think would be beneficial. I think mandatory screenings for professions that may have a firearm, that seems reasonable. But for other professions, not as much. So I think there's a balance between the two that you can see, making it affordable and universal. That really appeals to me.
So doing,
So just a combination, some elements of both.
so both.
More of the
options.
middle of the road as opposed to the two extremes.
And which is something, of course, we're not, when we present these in this deliberation, we're not saying we must do number one, or just number two, or just number three. It could be 5 different options that are.
There's a balance that you're looking for.
Okay,
I just have a question. How do you know you have good mental health?
how do you know if you have good mental health?
How do I know if I'm in good mental health?
That's a great question.
Because when you talk about the media campaign and promoting mental health screenings, it's like, how do you know when you're not? When you know, how do you know when you need help and when you don't need help?
That's a great question. Anybody have any thoughts on that? How do you know when you're in trouble somewhat emotionally?
Education in school,
Pardon?
education in school system.
Education, so
Yeah.
getting
like-
educated within the school system
Yeah.
about mental health issues would help. Okay.
I think when the behavior or the symptoms are more persistent, in dealing with a family member, you know, it wasn't just like something that happened at school that, you know, sent it into a downward spiral. It could have been anything. You know, if someone talked about her or did this or that, it really wouldn't matter what it was. And it could trigger something, could have been something that happened in the past,
So
that
confluence.
manifested itself for some reason.
Yeah. So what I'm hearing, correct me if I'm wrong, is that it might be helpful to learn more about mental health and some of the signs that are good about being mentally healthy, but also some signs that are red flags, and that, hey, wait a minute, I'm doing something that's detrimental to my family, to my health, et cetera, et cetera. So maybe an action step on this one, if we could put down, Chris, would be some sort of education around mental health, defining mental health and perhaps mental illness. Is that
Along that
okay?
line, this woman that I spoke with yesterday, and she's a retired nurse, but she said this was very interesting what she found when she was visiting over there. In their school system, they emphasize social skills more than we do in the pre-K, the kindergarten, and up to grade 4. And then when the kids get, right now I can't think, what age would you be, like 10, probably?
That's 5th grade.
That's when they really start to hit the academics. She said, I wonder if our schools are, really, she and I never mentioned the word like mental health as we taught, but she's like, I wonder if we're ignoring social interaction one-on-one between children, especially, she said, as she observes other children. They're all on these, they're not communicating verbally with people as much as they used to.
That was interesting, because last week, the Prairie River Middle School counselor, Trina, talked of that limiting access 24/7. is a bit much for kids and, you know, putting devices away at home so that they're taken offline or off the stressors, if you will. It was interesting, last night I met with a gal, and she wants to take this another step because there's a group of people meeting right now, a PO officer, a former meth addict, and then she's a life coach. And they want to take this a step further because she thinks we're worried so much about the symptoms, the addictions, the suicides, the safety issues. She says, why aren't we doing things at a younger age in school to address causes? And and that just further, that may turn into a program. I knew she'd be frustrated tonight because of the setting, so I said, hold that thought, you guys work on your, and we may do one for that. We'll see in the future.
But in the Merrill district, isn't it true that over the years, and you had been a school psychologist, that they've continually moved money away from that?
Yeah.
And now you have a ratio of one school psychologist to how many children?
I think it's remained the same or may have actually increased because of decline in enrollment. But we always had 3, and I still think they have 3.
No, I'm not talking about the number of school psychologists, I'm talking about the percentage, or the numbers of students for every one psychologist.
And he's saying it probably went up because we have reduced enrollment compared to him back then. But she was into the screenings and helping kids with life skills, and we're missing a whole lot at a age appropriate.
Chris, why don't we put that down, that Marianne is making the point that school screenings, so earlier education with social emotional skills and knowledge and so forth.
So that's an interesting point, Marianne, that you can kind of detect this before they become full-blown just by noticing the social skills, the norm, and if they fall below that.
If I might throw in, and it's worth pointing out, so I mentioned before, we've got the Diagnostic and Statistical Manual, currently in the 5th edition. That's the book we refer to that lists all of the mental health conditions out there. The problem with that is it is a very dry, very rarefied document. These diagnoses, very rarely does an individual present with a textbook diagnosis. And in fact, one of the diagnoses in there is someone who's faking their illness and has a mental illness because of trying to fake something else. At any rate, so you wonder, did they read the book before they came in? But so that is really, at some very fundamental level, intended much more for classification and academic work. To your point about how do we know what is good mental health or what is mental illness, it exists on a spectrum from people who have strong coping skills, the ability to deal with all of the different stressors that they're facing in a particular time and place, to people who lack any and all coping skills or are so overwhelmed by their stressors that they can't deal with them at all. And think on that spectrum, sort of good versus poor mental health, with these specific diagnoses falling in along that spectrum. So it's not very clear cut as to where you draw that line. In the same way, physical health. You have people who are very physically fit and are professional athletes or do extreme feats of all sorts of things human beings can do, up through people who have extreme illness and are physically debilitated and end up in a institution like a nursing home. You can think of that same spectrum for mental health like physical health.
So, any other comments? Thank you, Steve.
Yeah, you asked me to tell a joke. This isn't a joke, this is the truth, and maybe a problem is the diagnostic skills or lack thereof of the diagnostician. John had a colleague who will remain unnamed, thanks to confidentiality rules in this room, who was struggling for a diagnosis of a child many years ago. She's long since retired. And finally she came up with her diagnosis. I don't know that it's in the DSM-5, but it was tight underwear fit.
They thought she was hyperactive.
Due to tight underwear fit.
Yeah.
Sometimes you work with what you've got.
Employees included.
So is your friend
To Marion's point, we may not be teaching the adequate coping skills necessary, especially with a culture that says, just get over it. Such that young adults and now middle-aged adults and older adults lack some of the fundamental coping skills to deal with the different stressors that they're experiencing. And that then creates psychic distress. If you don't know how to cope with this, you revert to your habits, the things that you've always done. And if that's alcohol to help you relax, that can lead you down a path of addiction, same with other substance use. If that's a negative internal dialogue that beats yourself up, that can lead you down the road to depression. If you're prone to fits of great excitement with some of that depression, that can unhinge a bipolar episode, though there's some genetic causes that play a role in that. I can't give you a cause of example for schizophrenia because we don't really understand that, but it's if you're exposed to the wrong stressors at just the wrong time in young adulthood, or in some cases in middle adulthood, that causes a split in the brain and results in the delusions, the paranoia, and the internal voices that people hear. So, while each person's story of mental illness is unique, there are lots of coping skills we could teach people that might help them avoid falling into the mental illness side of that spectrum. And if we were teaching those at early enough ages, they become the ingrained habits that everyone falls back on, and we see less people suffering mental illness. In the same way that if we teach kids to exercise earlier in life, make healthier food choices, we see less physical illness later in life.
So education, obviously, early on is important, and
Yes.
we need to continue to try to focus on the social emotional.
I believe there's a big focus in our culture now, it's relatively new, it's called resilience skills.
Mm-hmm.
That would be.
That would fall into this category of building those coping skills, building that ability to deal with stressors as they come along.
For purposes of our deliberation, let's go on to option 3, and we'll go through that one. As a society, we have become oversensitive to behavior that previously would have simply been considered different. In the majority of situations, a person's state of mental health doesn't affect others. Yet professionals keep expanding definitions of mental illness to encompass more and more. But not everything has to be treated and medicated. Even when problems exist, people should make their own decisions about whether to seek treatment. This option holds that we should not rely on so many medical approaches. We should reduce our dependence on drugs and allow people the freedom to plot their own course to healthy lives. In many cases, simple changes in lifestyle can improve mental health. But such a hands-off approach may ignore people who are potentially dangerous and need intervention. So please take a minute or two and take a look at those examples of what could be done in the trade-offs. Okay, as we look at this approach, what, again, do you think would be some good points that are made, some advantages to it? Letting people do their own thing and have their own lifestyles?
Did they experiment in the sixties with that?
I'm sorry, what?
Speak up.
Did they experiment in the sixties with that?
Yeah, look what happened, I mean, all these beautiful people.
Not the prohibition against drugs on television.
I'm sorry, there's a,
I like the preventing drugs from being advertised on TV.
Oh,
I think that
okay.
would be beneficial just in general.
I've never understood that.
It's interesting, I was in a workshop actually last week, and the person presenting said that we do, and maybe Tom can talk to this as well, cognitive behavior therapy is popular in our culture, but to deal with emotions, we go to medications. Do you think that that's true? Do you think that that's kind of the way society has gone and insurance companies have gone? They're gonna, you do cognitive behavior therapy, we'll pay for that.
Goes back to the quick fix. We're a quick fix society, so if you feel this, take this, you'll feel better. I mean, that's what people want, and that's why the drug companies, I mean, that's what.
Get 10 sessions and you're out of here.
Yeah, I mean, people don't want to do the long, we've talked about that. You know, that people want the medication to make it better right now.
So they want to go to that, you know, if they don't want to go to that 3-week retreat over in Germany or where, they want to just get the medication and.
It's 30 seconds in the doctor's office to sign the prescription, and then you take a pill a day, and a month or two later you're feeling better and life is grand, as opposed to an hour a week after a bunch of insurance headaches and paperwork, and maybe it doesn't get paid for, or it doesn't get paid for at all because it wasn't part of your benefits plan, even though it was supposed to be. And so it's the uncertainty of, is this covered and how much is it going to cost me, versus, oh, yeah, I can take this and it'll make me feel better.
Well, if you live
Probably.
paycheck to paycheck, you don't have the time or the resources to necessarily do the long treatments.
And the stressors that provoked the issue in the first place haven't been addressed.
Well, that 2 o'clock Channel 9 doctor show that, then I turned that on to listen. I heard just the beginning of it today. And some woman, her meds were $23,000 a month. It was not helping her. Her insurance was paying it. And she was becoming very ill. Like I said, I didn't pay very close attention. I just was listening in. But I think those are 4 doctors on that program. These are all medical doctors, and to me, they sound like they know their stuff.
It is an interesting show.
Yeah.
So she's paying a lot of money, and the results are.
She was becoming very, very ill.
Yeah.
And I don't, you have, people who do have insurance, I think are sometimes taking too many. I'm past 75, I take Centrum Silver vitamins. But I don't take any prescriptions.
Why do you think, general question, why do you think that we are as a society so dependent upon medications?
I've seen too many of my friends that had like 12, 14 different. I was never like interested in that.
I go back to the ads on TV. If you watch television, and I actually have done this, where I just count the number of ads in an evening that are drug ads. It's 75, 80%, especially if you watch certain channels with a demographic. And my grandmother was on 20 different medications. Every time she watched a commercial, she had that. You know, and so the doctors just kept prescribing these medications, and it was like, and until she went into a nursing home that really looked at her medications, she was down to 3. Someone had to look at them and look at, this medication was creating this side effect, which she was taking this medication for to get rid of that side effect, which was creating this. I mean, it was just a web And until someone actually took a look at that medication and how many she was taking and got rid of the medications that were countering the side effects.
A prescription cascade where you take this one, it causes side effects, so you cut another one, which causes side effects to another one, and then if you just stop the first one in the first place. There are guidelines for prescribing, but if no one's gone back to look at the med list, we benefit in this area because we only have a couple of health systems, and so it's not that hard to get a fairly comprehensive list of what someone's taking. But if you go to, say, New York, particularly New York City, where there's a doctor every third floor on many of the high-rise buildings, they may or may not be using electronic record systems, they may or may not be tied into hospital systems or pharmacy systems, and you may end up with 5, 6, 7, 10 different medication lists to try and reconcile together, and everyone's prescribing something different, and it becomes a big mess. And the drug companies recognize some of this, so they advertise to the consumer directly in a way to get you to ask whichever doctor you're seeing, and then they may prescribe that to you, and they may or may not know everything else you're taking. It is a big problem, so much so that we teach young physicians, new physicians coming into practice, about this process of medication reconciliation, to look at the list and evaluate it against what you're treating and why you're treating it, and the goals of the patient. Because someone who's 75 probably doesn't need a cholesterol medicine whose benefit is going to take 10 years to realize the reduction of 1 heart attack in the 100 people you have to treat. So you probably don't need a cholesterol medicine at that age.
Cholesterol's fine.
Right,
But I
right,
do
right.
have-
I was not thinking on you, Mary. So much as pointing out that that's something that you have to think about. And if you've already been on a cholesterol medicine since you were 50, and you've now been taking it for 25 years, because some of those have been out that long, you may not think anything about taking it. And that's,
But no, I do have to admit, I'm a cancer survivor, and the chemos that they gave me, I was first told at St. Joe's, there's nothing we can do, stage 4. I am a survivor because of chemo medicine. But after my husband passed away, I stopped taking the oral chemo because they still had me on that. It's like so expensive, and I told the kids. After 14 months, I started feeling better again. And I am babysitting my 2-year-old and 3-year-old
More energy than I have.
between 12 and 15 hours a day. And I'm mowing the lawn, except during those couple of hot days.
those, by the way, are excellent coping skills for the mental health side of things, to
Yeah.
have interactions with family, to have things that keep you busy throughout the day. We know, coming back to the mind-body connection from before, that when you're physically active, your mental health improves. And when you have good mental health, you tend to have better physical health. So,
I had a question with regard to, so we've described some of the pharmacological or the drug industry, and it feeds into the hospitals and the clinics and all of that sort of thing, and it feeds into TV, and we're marketed all this stuff, we've got all these medications, and it's the quick fix, all this stuff. Do you think this approach is really realistic? In our society, can we really withstand all of those pressures or influences and lead healthier lifestyles, or is that really kind of unrealistic for our American society?
Universal health, you don't have all the ads. If you went to universal health, if we went back, but you wouldn't have all the ads.
That's not true.
No,
Not necessarily.
No, you could, even with universal health, if they convince you that you need statin drugs, which is the #1 prescribed drug, that is also the studies have shown it don't have a whole lot of good effect.
I'm going to disagree with you there, but we can take that.
Okay.
That class is the most studied class of drugs. More than 3.5 million people will have been studied with those, and the benefits are some of the strongest we've seen of any drugs we prescribe. But we can talk more later.
Okay.
Sorry.
So to get back to your point, go ahead.
Okay, well, I didn't realize, okay, so let's go back. So, yes, I guess I'm an optimist, because if we would really want this to be the course, why couldn't we have counter ads talking the opposite effect?
Yeah.
the mind-body connection and.
Or
so
a
it's
social
more-
Like good food and
Right.
exercise.
Yeah, I'm just wondering, when the last time you walked into a doctor's office and you walked out with a prescription for yoga, qigong, a walk in the woods?
Well, the
You
insurance
get a
don't
spot,
cover that.
right?
See, but that's the problem when the insurance covers prescriptions, it does not cover chiropractors or acupuncturists, or it covers 2 sessions and then, you know, so that's the other.
But this type of focus might push it in that
Right.
direction. That would
Right.
certainly be a
I
benefit.
think that people need to ask for it.
Tom, I'm gonna ask you, put you on the spot a little bit, but what do you think? I mean, with all these societal influences, do you think that we're just gonna keep going down that road, or do you think that we have the ability to take more control of our lives, be more motivated to make healthier decisions?
Or, it was funny, I saw a copy of DSM-5 here. I actually have a copy of DSM-1. And it's like that thick. The regular DSM-5 now, the bigger version,
Yeah,
the
the whole
standard
version.
version is like that thick.
Mhm.
And that's in the course of 50 years maybe.
What's a DS?
It's the manual that says, here are all the diagnoses for mental health that psychiatrists or psychologists can give out. And it's gone from a book like that to a book like that. Over the course of 50 years, it's expanded. So, you know, I'm not saying that's all bad, it's not. I mean, we're focusing on some things that people need help for. But I guess I'm a kind of an economic determinist in that as long as there's money to be made by insurance companies for this, you know, they're gonna keep pushing that, and it's gonna be tough to resist. One of the things that's kind of interesting to me is, in fact, I was just looking at it today, I've got security health insurance. And, you know, they pay for tons of things, and finally, they're paying a little bit now if you join a health club. And compared to the amount of money they've paid out for operations and medication and all that, it's probably 1/10 of 1% that they're willing to pay out to encourage you to get into a health club and do something positive. So, I mean, there's just a lot of factors working against the kind of thing you're talking about, to become more healthy, more health conscious, more aware of mental and physical health. It's a tough job.
Thank you, Tom.
Yes. I don't mean to, I just had a thought, a lot of, I'm part of a CEO group, and they're starting to put clinics into their companies. So preventative care, and they're very much on the health, the mental health part of it too. So that's turning too, because they want healthier, productive employees, and, you know, it's smart business.
Which would
It's-
decrease their insurance costs, is that correct?
Right.
I mean, if
Oh, yeah.
less people are saying I need insurance to cover this.
What they do is have a very, very high risk insurance pool, so they pay for everything, so that healthier, more preventive care, it's economics, it's a money saving and good, and the employees love it, so it's win-win, so. that's just-
So I got a quick question for you, and then I have a few other quick questions, and I'll let you go, but is there any common ground, we covered these 3 options, with regard to getting tougher with mental illness in terms of having much more oversight with the people in our society. We've talked about the other option here of providing tools and providing therapeutic services for everybody, universal health care. We've talked about taking the whole thing on ourselves and saying, look, we need to be more responsible as individuals with our mental health. Is there any common ground or any large ideas that you think we might be moving towards as a group this evening?
I would say society is focusing more on mental health in general, but the culture is shifting towards that focus in a greater way, where you would see changes.
So we're actually talking about it more, we're seeing more awareness of it, and sometimes unfortunately because of something that happens.
Right, but organizations are taking action.
Any other thoughts about where we might be moving towards as far as our group thinking?
I think education is part, and start the younger we can start, I think the better. I mean, as this group, I don't know if society understands it or comprehends the benefits yet totally.
So So the education, we talked quite a bit about education as far as what is mental health, what is mental illness, and then getting more social emotional types of learning experiences for the younger kids and moving up, through the grades and so forth. And we talked about universal health care as well. Is that something that is a major theme, or is that just? How many people would be interested in that? Just raise your hand if you're interested in that. Heavens to murder. Okay, so it's something that.
But it wasn't unanimous.
It wasn't unanimous, but I know this, that I'm old enough to be on Medicare, and, I mean, what's not to like about it? I like it.
Single payer.
Except what does that mean?
That's another deliberation.
Yeah, there you go.
Okay, I want to get you out of here on time, but I do have one thing that I want to ask you to do. You have a little piece of paper and a little pencil in front of you. Would you answer two questions for me? The first question on the first side of the paper would be, now that we've discussed mental illness in America for the last hour and a half or so, what is your greatest concern about mental illness in our community? What is your major concern about mental illness in our community? And then on the other side, what would be one action step that would help fix that concern? What's one action step that you think, doesn't have to be a big one, what is one step that you think we could take as a community or individually to help fix that concern? So what I will do with those pieces of paper is I'm going to cluster them into different categories. There might be 2 or 3 or 4 different categories of concerns, and then I will put the action steps together with those clusters. And I'll get them to you if you would like via email. And I found this exercise to be interesting because this is about us in our community right now, and it's a local perspective that we're getting. So I appreciate you doing this. And there are a couple of announcements. Real quickly, I know Debbie brought some information, Christine brought some information, and I'd like to talk just briefly about some information I gave you. So Debbie.
Sure. Coming up on October 26th, it's a Thursday evening, the Lincoln County Drug-Free Coalition, which there are several people in the room that are members of that coalition, is going to be hosting a county education forum. And it's specifically focused on the misuse of opioids and the use of methamphetamine in our county. And we will have Representative Felskowski there. We'll be talking about an overview of what we're seeing in Wisconsin and how Wisconsin is trying to address that. And then we'll also be hearing locally from representatives of the local schools, what they're seeing, medical hospital, law enforcement, and the judicial system, and what they're also trying to do to address the issue. So it's a beginning conversation. I felt, based on last week's conversation, and even tonight it's been referred to the connection between mental health and substance abuse, and so thought others might be interested in this forum. It's going to be in the Assembly Room in the Service Center at 801 North Sales Street. At 5 o'clock, we will have agencies and organizations will have the display set up that you'll be able to go around and kind of see what resources there are in the community and learn more about their programs. And then at 5:30, we'll officially start the forum. We plan to be done by about 7 and have time for Q&A at the end, and then also time to, again, visit the displays again, as well. And we will be having appetizers. We have received some funding from the Northwoods Coalition to be able to provide appetizers for the evening. So
Thank you, Debbie. What's the date of that again?
October 26th.
And Kristen, did you want to?
Yeah, sure. I just brought this resource as a handout that you can take a closer look at, but kind of in follow-up to the presentation from last week, I included some mental health data just to provide a synopsis of mental health in our county. And then as we start to look at possible action planning and developing strategies, I just thought it would be helpful to see like what the Lincoln County Mental Health Coalition goals are, so you can get a local perspective, see what the goals of the state are as far as mental health, as well as at the national level. And then there's just some best practices, promising practices, some strategies that, you know, maybe we could get rolling locally, just to give us some direction.
Thank you so much for all that information. I'd just like to make one little announcement about the group that has evolved over the last year in conjunction with the TV Scott Library, which is, they call themselves Aware and Active Citizens Group. And it's in conjunction with TV Scott has developed this Building Merrill Together program series, and there are a number of different events that have occurred over the last year and will continue to occur, and it's probably on a monthly basis, and the library is hoping to continue that. So this is one of them, and we appreciate your coming to that. With regard to the Aware and Active Citizens, there are quarterly meetings, and I just want to call your attention. The next one is going to be, we changed the date to November 29th. It's from 11:30 a.m. to 1:30 p.m. and lunch is provided. It will be here. Lunch is provided by the library this time, and we'd love to have you come because we're going to talk about the, as Debbie knows, with the Interagency Advisory Council that meets, does it meet 3 times a year or 3 times a year? It's kind of the same concept in the sense that community citizens can come from various sectors of our community and talk about what's going on in their organizations. But also, you'll notice we have some action teams that have developed from the AAC, Young People's Action Team. For example, Eric and Kyle and Heather are part of that. We have a communication and technology team. We're trying to bring together resources in the community to become more nimble as far as communicating what we're doing. The Entrepreneur and Business Action Team, Renee and Todd have taken that bull by the horns, and they're actually, I don't know, Renee, if you'd like to say a few words about Terry Whipple.
Terry Whipple, who is the Economic Developer Director in Juneau County, started he calls it an inventor and entrepreneur club over 10 years ago, maybe 15. He has over 4,000 members, and Juneau County at one time had the highest unemployment rate in the state, so it was struggling. He came in and he's had many success stories and continuing, and the one they're working on is with I always forget how the water gardens. So, but they come there once a month, they meet and they have different speakers and so on and so forth. So my hope
is that we can start one ourselves here in Lincoln County. And part of the idea is to hopefully use the production lab at the high school, so even if you have an idea, possibly you can develop that idea there too. So everything is just right now out there, and so we're seeing if we can put something together after Terry's talk.
Sure.
So
When
it's
is it?
November 2nd at 6:30 at the high school library. And then they're gonna have tours of the production lab then too. So we're still putting stuff together.
So essentially, the AAC, that whole thing is just to try to have a venue for citizens to become active. And we appreciate, for example, Debbie and Kristen and Sherry coming, because obviously you're doing all sorts of work in the community, and we're hoping that we can augment your work with citizen action. So, and if you have any questions about it, you can contact me down at the bottom, or Lori Boloff at the library, and we can talk more about it. So thank you so much for coming to the
And there is
deliberation.
a Facebook page.
It's,
Oh.
Merrill, or facebook.com/Merrill AAC. Merrill Aware and Active, and then there's also the Young People's Action Committee has its own page.
So Merrill AAC, because I had a hard time finding it. So I always have him say it, on Facebook, Merrill AAC, and then the Young People Action Team. But thank you, and again, give us food for thought and enthusiastic participation. Thank you. Thank you to Merrill Productions for being here to record.